The battle for transgender youth healthcare. South Carolina joins restrictive states. In a divisive move that has drawn widespread condemnation, South Carolina has become the 25th state to restrict or ban gender-affirming care for transgender minors. The law, signed into effect by Governor Henry McMaster, prohibits health professionals from performing gender transition surgeries, prescribing puberty blockers, or overseeing hormone treatments for patients under the age of 18. This law poses significant barriers to transgender youth seeking essential healthcare, which has been shown to be life-saving and life-affirming. Research has consistently demonstrated that transgender individuals, both youth and adults, face heightened risks of stress, depression, and suicidal behavior when forced to live as the sex they were assigned at birth. LGBTQ+ rights groups have expressed outrage over the law, vowing to challenge its legality. The Human Rights Campaign, HRC, has called the law cruel and discriminatory, while the ACLU has stated that it violates the constitutional rights of transgender youth. The law also mandates school principals and vice principals to notify parents or guardians if a child wishes to use a name other than their legal one, a nickname, or pronouns that do not align with their sex assigned at birth. This provision has raised concerns about the safety and privacy of transgender youth, who may face hostility or discrimination if their gender identity is revealed without their consent. In response to the law's passage, LGBTQ+ advocacy groups are mobilizing to provide support and resources to transgender youth and their families. The Campaign for Southern Equality is gathering information to help families find healthcare providers outside of South Carolina and the surrounding states that have enacted similar bans. Healthcare is a human right, and it breaks my heart to see lawmakers rip away life-affirming, often life-saving medical care from transgender youth in South Carolina, said Raymond Velasquez, Executive Director of Uplift Outreach Center. No one should be forced to leave their home state to access the care that they need and deserve. Supporters of the law argue that it is necessary to protect young people from irreversible decisions. However, medical experts and transgender youth advocates have testified that gender transition surgeries are not performed on minors in South Carolina, and that hormone treatments are only initiated after extensive consultation with healthcare professionals. The law has also drawn criticism for its lack of scientific basis. Supporters have cited unpublished evidence that puberty blockers increase self-harm and can be irreversible. However, medical research has not corroborated these claims. Despite the passage of this restrictive law, transgender youth and their allies remain determined to fight for their rights. To all of the young people in South Carolina and their parents who are reading this news and feeling fear for the future, please know, no law can change the fact that you are worthy of dignity, equality, joy, and respect, said Christina Picozzi, Executive Director of the Harriet Hancock Center, an LGBTQ+ advocacy nonprofit.